we were just going through the list of the options that you'd included in the plan, and you'd gone through some of the tax options. Let's
Right.
turn to particularly the Social Security and Medicare options.
Yeah, yeah. And so the tax options, they get you money now because we do need money now, unless we start making significant cuts now if we want to avoid this exploding debt path that we're currently on. So those are kind of the upfront stuff. But the fact of it is you can't solve this problem with just taxes. And a lot of people don't realize is that the United States has by far the most progressive tax income tax system amongst the OECD, where 10% of the population pays 75% of federal income taxes, not including payroll taxes. And that's way more progressive than anything in the OECD. So there's just not enough room just to tax our way out of this, unless we consider things like a value added tax and things like that, which are very not super popular in the United States by both sides. So on the spending side, what we do is we start to say, you know what? There has to eventually be a change in Social Security and Medicare, how they actually are administered. So Social Security started as a pension program, and that had good, certainly political optics and so forth. And I don't want to get all nerd fest into all the economic details behind it, but essentially what we're saying here is a couple things. One is that at some point the retirement age has to be indexed closer to the actual longevity, like what they do in Singapore. They explicitly index it. We need to make announcements today about what that's going to look like, even if it's not fully phased in for 50, 60, 70 years. And so give people the time to respond, to save, younger people understand what's going on and so forth. And so there's partly that raising the full retirement age, not hitting anybody below age 50. And then even of those at age 49, it's not a jump. It's like an additional 2 months, normal retirement age. So just slowly raise the retirement until we hit age 70. By the way, we would already be at age 70 had we been indexing. Well, in fact, the age 75 had we been indexing for our lifetime expectancy all along. And then another thing is that we're going to eventually bring up low-income benefits. A lot of people don't realize Social Security does not guarantee that you stay out of poverty. This would guarantee that people stay out of poverty, but the cost of that would be lowering high-income benefits. And eventually by 2070 something, we're going to basically have a flat Social Security benefit that's mainly just a very simple benefit that's not meant to be the normal source of retirement, but as a complement to retirement. And then with Medicare, some changes there to allow for actually a little bit more competition and pricing, as well as a phase in slowly from age 65 to age 67 of the normal retirement age of Medicare. It is true this one would start sooner because we've really fallen behind on that one, but nonetheless that would start a little bit sooner, but still a slow phase in. And then the last big piece is immigration. Yes, I mean, we can't just say, we're going to get rid of undocumented workers. There's 11 million of them. Without immigration, we're going to shrink as a population because we actually are not replacing ourselves. And so the criticism of immigration is they come in, they use the healthcare system and so forth. We're saying, immigration, overwhelmingly economists agree that immigration is a positive for the United States, especially high education, STEM workers, and so forth. But we can solve the obvious problem people claim about legal immigration coming in using the healthcare system. The cost of entry is not some big expensive lottery. The cost of entry is that you have to buy your own healthcare. You cannot use the Medicaid system. You have to have proof of insurance. Your employer has to pay for it. If you're not employed by an employer, you have to have health insurance yourself. And that mandate on just new immigrants, it wouldn't be existing immigrants, but it would just, would just be new immigrants coming in. That mandate actually, instead of taking away from the healthcare system, it does exactly the opposite. It so favorably improves the risk pool because these immigrants tend to be young. and they tend to be lower risk. It actually improves the risk pool. Native-born workers will actually see their premiums go down. In fact, go down by almost 27% from this change.